To start with, this is just a visual summary of all the breast lesions we're going to speak about. Take a moment to study this image, as it will help consolidate the locations of different breast pathologies. Nothing new here, but it's a good way to conceptualize. First, we'll discuss benign breast tumors. Fibroadenomas are small, mobile, firm masses with sharp edges. They're the most common tumor in females less than 35 years of age, and are estrogen responsive. Because they're estrogen responsive, they grow and are more tender during pregnancy and menstruation. It's important to realize that they're not a precursor to breast cancer, and do not increase a woman's risk for the disease. So if it ever comes up on step 1, the appropriate response is to reassure the woman that everything is fine and no treatment or monitoring is necessary. The next benign breast tumor is the intraductal papilloma. Intraductal papillomas are small tumors that grow in the lactiferous ducts. You often find them beneath the areola. They're a very common cause of serous or bloody nipple discharge, and are associated with a very slight increase in the risk for breast cancer, so they're of a bit more concern than a fibroadenoma. Lastly, Phyllodes tumors are large and bulky tumors of connective tissue and cysts. They occur late in life, typically after turning 60. Phyllodes comes from the Greek term phylon, meaning leaf. You can kind of see the leafy projections here on this micrograph. They have a greater risk of malignant transformation than intraductal papillomas. So now we get to a topic of pretty major clinical and cultural significance. As we all know, breast cancer is the most common cancer in females. They most commonly occur after menopause. The hormone sensitivity of breast cancer plays a major role in characterization of these tumors. The most important receptors are those for estrogen, progesterone, and HER2, which is a member of the EGF family. Overexpression of estrogen or progesterone receptors, or HER2, actually dramatically changes the treatment and prognosis. For example, if a breast cancer is estrogen receptor positive, it may respond to a selective estrogen receptor modulator like tamoxifen, which we'll discuss in a later talk. That being said, the most important prognostic factor is if the cancer is made it to the axillary or sentinel lymph nodes. There are several risk factors, most dealing with increased estrogen exposure, longer reproductive time period, increased peripheral conversion in adipose tissue, etc. You might see these in the stem of a board's question. The main types of breast cancer are ductal carcinoma in situ, or DCIS, invasive ductal, invasive lobular, medullary, comedocarcinoma, inflammatory and Paget's disease, and lobular carcinoma in situ, which is not listed here. While you're not expected to know all the details about each type, knowing a few distinguishing facts about each will certainly help you on the boards. DCIS, as the name implies, is a ductal carcinoma that has not yet invaded the basement membrane, making it very treatable. In the image, you can see monomorphic neoplastic cells filling the lumen of the ducts, but not expanding past the basement membrane. One subtype of DCIS is comedocarcinoma. It's characterized by caseous necrosis, and is isolated to the ducts. Little bit of micro-review. What major lung disease do you also see caseous necrosis in? That's right, tuberculosis. DCIS becomes invasive ductal carcinoma when it invades the basement membrane. These tumors tend to be a firm, fibrous mass with sharp margins. They make up about 3/4 of all breast cancers. Invasive lobular occurs in the breast lobules. Key fact to remember for lobular cancers is that they're often bilateral. By the way, speaking of female tumors, do you remember which ovarian tumors are often bilateral? The answers are ovarian serous cystadenomas and cystadenocarcinomas. Medullary cancers account for about 5% of breast cancers, typically occurring in younger women. They're characterized by fleshy, cellular, lymphocytic infiltrates. Inflammatory breast cancer has a poor prognosis, with a 50% 5-year survival rate. If the question is about inflammatory breast cancer, the question stem will often describe skin changes, in particular, changes resembling orange peel, otherwise known as peau d'orange. The skin changes are caused by blockage of lymphatic drainage. As you can see in this image, Paget's disease of the breast looks like there are eczematous skin changes on the nipple. You can sometimes also get a bloody discharge from the nipple. The large and irregular malignant cells are known as Paget cells. You can also get extramammary Paget's disease, which has the same histological features. Let's run quickly through some common breast conditions now. These descriptions may seem sparse, but realistically they're all you need for step 1, so only worry about going out and getting a more complete picture if you're interested. The most common cause of a breast lump in a female between 25 years of age and menopause is fibrocystic disease, also called fibrocystic change. It usually presents with premenstrual breast pain and usually resolves after the period is over. In fact, this condition tends to go away with menopause. These lumps can be bilateral and often fluctuate in size. Fibrocystic disease is usually benign, and they are usually not associated with cancer. There are 4 types of fibrocystic disease worth keeping in mind. It may help you to think about these conditions in terms of location. Fibrosis is simple hyperplasia of the breast stroma, whereas cystic is ductal dilation that leads to fluid-filled cysts. Sclerosing adenosis occurs in the breast lobules and is associated with calcinosis. Epithelial hyperplasia is in the terminal duct and lobule, and it can be associated with carcinoma if there are atypical cells. Acute mastitis is basically a breast abscess that occurs during breastfeeding, most commonly caused by Staph aureus. Fat necrosis is most commonly associated with either injury or trauma. It is painless and benign, and most patients can't recall how it got there in the first place. Gynecomastia is the growth of breast tissue in males in response to hyperestrogenism. There are many causes of gynecomastia, but you have to put drug side effects at the top of your list. So a great mnemonic we have for drug-induced gynecomastia is, some drugs create awesome knockers. For spironolactone, digitalis, cimetidine, alcohol, and ketoconazole. Otherwise, gynecomastia occurs in high estrogen states like cirrhosis, puberty, old age, as well as in Klinefelter syndrome, which we discussed at the very beginning of the section.